This is Dr. Govardhan Reddy, HOD and Director of Urology Services at Sakra Hospital. I'm just talking about the role of chemotherapy in CA prostate. So a lot of patients have a misconception that whenever we say the treatment, medical treatment for cancer of the prostate, they think it is chemotherapy. Most of the time, the hormonal treatment is the mainstay of treatment for prostate cancers. The role of chemotherapy will only come in a very limited fashion once there is a huge metastasis, multi-organs are involved, or huge burden. Whenever there is a huge burden, that is the time we use what is called chemotherapy. We also use chemotherapy in cases where we have used hormonal treatment, but there is a resistance which has developed because of hormonal treatment. So what we call hormone-resistant prostate cancers. So in hormone-resistant cancer also, we use what's called chemotherapy. There are other type of CA prostate like neuroendocrine tumors. So when there is a neuroendocrine component, that is also a stage where we use chemotherapy. Important thing about chemotherapy compared to chemotherapy for other cancers in prostate cancer is there is only two drugs which we use. One is docetaxel, one is cabazitaxel. These two drugs are the only drugs we use for chemotherapy. So the side effects which all people are afraid, like loss of hair, loss of discoloration, anything happening is very less in this chemotherapy compared to other chemotherapy. This is not a strong chemotherapy and it is a very easily administrable chemotherapy. So many patients do respond to chemotherapy. So as I said, there is a role of chemotherapy in prostate cancers in only limited conditions when there is an huge metastasis, multi-metastasis, huge burden of disease, or in those patients who are not responding to hormonal treatment. So these are the situations in which we use chemotherapy. And to emphasize again, the side effects as we see in chemotherapy of other cancers is not seen in this. Thank you.